Newport News Shipbuilding continues efforts to stop and control the spread of COVID-19. With that, the shipyard has recently brought on Dr. Vijay Subramanium to help in that effort. And he joins us now to talk a little bit more about COVID-19 and how the shipyard is handling it. So, Doctor, we appreciate you being with us today, and just want to point out that we're socially distanced. We have our masks ready for that as well. So, thanks a lot for being with us. I know you're a busy guy. So tell us a little bit about your background. We're introducing you to the Shipbuilders, the first time a lot of them will be seeing you. So tell us about yourself.
Well, my name's Vijay Subramanium. I grew up in a really small coal mining town in southern West Virginia. Then after that, I went through undergrad, med school, and finished the majority of my training in Pittsburgh in pulmonary critical care and sleep medicine. We moved to the Williamsburg area in 2009, and I've been practicing pulmonary and sleep medicine in the area since then, with a large group of patients. In addition, I'm also the medical director of a clinical research lab. We're one of the few labs in the country that actually have been given a outpatient COVID-19 treatment trial, and that's where I've gotten a lot of my experience with COVID-19.
Great, so we'll talk a little bit about that in a minute. I want to ask you about kind of what's happening right now in Virginia, the whole state. How are things looking in Virginia?
In Virginia, you have to almost look at it regionally. So a lot of what I'm going to say, I'm going to concentrate on Hampton Roads. The bigger hot spots in the state right now are Northern Virginia, the city of Richmond and general area, and unfortunately Hampton Roads. We saw a large uptake that slowly came down as social distancing was put in place. We were in the early phases of phase 1, phase 2. And then, unfortunately, over July 4th weekend, I think people were just getting out. We were having more tourists come in. People were trying to return to some normalcy with parties, graduations, and as expected, we did see an uptake in the number of cases a few weeks afterwards. When the governor has slowly pulled back some of the other restrictions, especially with the bars and restaurants, we seem to be kind of leveling off. I am personally, and I think most people are, expecting a large uptake in the next few weeks. And the primary reason is everyone's trying to get their last minute vacations in, Labor Day weekend, kids going to from school, college. We're going to see an uptake, and I think that's a general expectation, is we will see an uptake probably starting early to mid-September. The big concern with that is about the time that should be starting to go back down, we're going to be entering flu season. Right. You cannot really differentiate just based on history. Is it flu or is it COVID-19?
So that is obviously a concern. How does that all translate into the shipyard? That's kind of where it gets difficult to kind of figure out, the trends in Virginia, the trends at the shipyard have been on the rise, kind of recently maybe leveling off a little bit, but.
The shipyard trends actually seems to be following the Hampton Road data pretty closely. We do not live in a bubble. Everyone goes home, everyone comes to work, they're spending time with their children. Children are getting back into sports and activities. They're having friends and family visit. Especially we've seen the majority of the problems with the younger population. They don't seem to get as sick as the older population, but they end up transmitting it to the older population. So my expectation is the same trend that we're expecting in Hampton Roads, which is going to be a large increase over the next couple of months, will actually translate into the shipyard. I've walked around the shipyard. I was very impressed on how everyone was socially distancing, wearing masks, hand sanitizers. Everyone's trying to do the right thing. Unfortunately, some of these exposures are going to happen. We just need to try and catch them as soon as possible and minimize the overall effect for everyone.
So from that standpoint, I think sometimes there's and maybe it's just hopeful thinking that, this is going to end soon, but it's really not. And I think that's what a lot of people need to understand. This is kind of for the long haul. I mean, even if we had a vaccine tomorrow, we still have a long way to go.
We were, back in spring, we were hearing that the virus is not stable in heat, that it was going to die off when summer hit. Unfortunately, that's been proven wrong. There are a lot of vaccine trials that are either just started or getting ready to start that I'm familiar with a few of those. And, normally a vaccine trial is a 2 to 3 year process. I know this is in the very forefront right now. Hopeful expectation would be a vaccine being available early 2021. That being said, by the time everyone gets vaccinated, we're going to be dealing with this for a good while. As the immunity just builds up in the community, hopefully we'll see a decreased number of cases and also a decreased number of people really getting sick from it.
And you touched on, maybe earlier thought that this may die off in the warm weather. This is a new virus. It's a novel virus, and I think a lot of people need to also realize that means we don't know a lot about it, right?
Exactly. Coronaviruses have been around forever. We've known about them. It's one of the viruses that cause a common cold. What they consider novel means it's the first time this particular strain of the virus has actually started to infect humans. We're learning. I'm reading the literature on a daily basis, and there's 10 new reports in the scientific literature that's coming out every day. Viruses mutate. We're hoping we get a vaccine and we get it in production, and we hope that the virus doesn't mutate to become resistant to the vaccine. Anyone who says they're a quote expert on this, there's a few experts out there, but most of the cases we're all learning at the same time everyone else is.
And so with that said, there is the frustration of, early on there was the message of a mask is not necessary. Social distancing guidelines probably changed a bit. What is your thought or advice to folks about that? Things can change.
We've actually seen a lot of retrospective literature where they've actually looked at what's happened. Probably the most recent best example I can give you is the state of Arizona. State of Arizona, when all this happened, they locked things down. The number of total cases they had were very, very low. Then they slowly started opening things back up, and it went from 10,000 cases to 70,000 cases. They all of a sudden decided to back things off, and they're starting to get level off and dropping back down again. So that is some proof that social distancing and mask wearing is necessary and works. The data out of Europe, the data out of China, that's really the way to do it. And if you look at other countries where they've really enforced the social distancing and really enforced the mask wearing, those are the countries with the least number of deaths and infections.
So we talked about vaccines. So explain your involvement in some of that as well.
So I currently am one of the, I think there's 5 centers in the country doing a COVID-19 treatment trial. We are evaluating vaccine trials every day. Hopefully we should have some more information on some of those trials over the next few weeks. They're getting started very quickly. There are companies out there that are hoping to have data by the latter part of this year, early part of next year. Most companies are already producing their vaccines, hoping that they get a positive response so things can get going pretty quickly. That being said, by the time we get enough vaccine doses out to enough people to do some good, and we're also hoping that these vaccines that are in trial have prolonged immunity. We just don't know. Like I said, the virus has a tendency to mutate, and when it does, sometimes the vaccines won't be as effective.
Do you see, we get a flu shot every year. Do you see COVID boosters, or you're getting your COVID shot this year?
I suspect that's what's going to happen. They're going to try and do what they do with the flu shot, predict what the common strains are, prepare the vaccine. I do not think this will be a 1 or 2 shot and done. I think it will be very similar to a flu shot. And that's what everyone's looking at right now. The nice thing is some of the vaccines they're looking at are oral. They don't require an injection.
So from a shipyard standpoint, there's been a lot of talk over the last 5 months about why can't we shut down? Shouldn't the shipyard maybe close for a while and let everybody get tested? All that kind of stuff. Talk a little bit about why that just is not probably going to work.
As I mentioned before, we don't live in a bubble. I do not live in a bubble, and I would not expect anyone else to live in a bubble. The shutting down, cleaning, one time, everyone get tested, that only works in a situation where everyone is in a strict environment. You will come to work, then you're going to go home and spend time with your family, your friends. That a one-time shutdown is not beneficial for that. One-time testing is completely useless for that. It tells you where you were at that point in time. So every time there's a new infection coming out and there's a new group, you can't shut down everything for another 2 weeks. It really has to do with surveillance, everyone doing the social distancing, and actually just, as soon as you find out someone's positive, tracking everyone down that's exposed and quarantining them and just trying to keep the overall exposure as small as possible.
So what advice do you have? I mean, it's difficult to social distance in a lot of the jobs here at the shipyard. What kind of advice do you have for shipbuilders?
We're actually looking at a lot of that right now. That was one of the reasons they did ask me to come on board, is try and come up with what the best options are to keep, the primary goal is keep everyone safe, period. That being the number one goal. Secondly, what can we do to keep people working at the jobs that they're doing? So there's a number of things we're looking at. We're requesting information from other companies. We're looking at a lot of options, but there should be some more information about that shortly.
All right. Anything else you want to add or say or let our shipbuilders know?
I'm glad to be here to help. You guys are a great family of shipbuilders and very well respected. And, the goal is to keep everyone safe in addition to keeping everyone at work, doing the job that you guys do very well.
All right. Well, thank you so much for being here. I know we're going to be talking to you a lot more in the future, so
well,
thanks.
Thank you.
And if you want more information, please make sure to visit our Newport News Shipbuilding COVID-19 411 website. Thanks.